Hello, everybody, and welcome back to the Surrogacy Space. My name is Marla Neufeld. Today, I have the very wonderful Karyn Rosenberg with me. She's a psychotherapist based in Florida and North Carolina. And Karyn helps many of my clients with part of the surrogacy process of the mental health evaluation. So that's what we're going to talk about today is what goes into an evaluation for the mental health perspective when someone's pursuing surrogacy. And welcome to the show, Karyn.
Thank you so much, Marla, for having me. I really appreciate it.
Yeah, well, you are an expert in this field, and I know you help so many of my clients and your patients going through this, difficult process. So I'm happy to have you here, and thank you for joining. Yeah, so just wanted to learn a little bit about your experience in psychotherapy and, kind of your background in your field.
Sure. So I kind of fell into this through a bit of a journey. My background started off as a grief counselor with a hospice a long, long time ago, back in the 90s, actually. And then after doing grief work, it led to doing infant child loss, which led to fertility, which led to being in the space. So I started my practice in 99. And after doing a lot of individual counseling with clients that were experiencing those types of losses and fertility, then I started working more on the side of intended parent and gestational carriers and donors as well. So I kind of have a nice overall, in my practice of covering all of those bases, which I
Oh,
love.
cool. You never know what will lead to the next area of your work. So it does sound like natural progression there.
Yeah,
And I know a large part of your practice is the surrogacy and, art evaluation, but do you still do other forms of counseling like what you did in the past?
yeah. So I'm still known for being an expert in grief and loss counseling. So my ongoing clients are a lot of that, doing grief and loss, doing I'm certified in perinatal mental health. So I do a lot of postpartum
Okay.
counseling for people on the journey, work with a lot of pregnant clients that maybe decide to come in and create a baseline with a therapist so that they can help on their journey when they're postpartum, and with the parent, with the partners as well that they have in their life. So kind of grief, loss, fertility, and perinatal mental health is the
Oh,
majority
that's
of my
amazing.
practice. And then the evaluations are usually more one-off kind of things, not the ongoing counseling. So it's a nice combination, which I love. And then
Absolutely.
as a sprinkling of something kind of unrelated, I'm certified as a hypnotherapist. So
Oh,
I'll
cool.
do some hypnotherapy with clients too, which is great for anxiety, stress, and, it's like a nice complementary approach to counseling. And I've used it in the grief world as well, and pain management and things like that. And then I'm trauma informed, trained in EMDR, which is a trauma approach
Yes.
for working with people going through post-traumatic events. Yeah,
Oh,
that's
that's
kind of what I do.
incredible. It's such an amazing service you offer people for helping in all these
Yeah,
different areas. That's really awesome.
thanks.
Yeah, so we mentioned that you're, based in Florida and North Carolina, and as you know, in the surrogacy process, parents are all over the world, surrogates are all over the country. Where do the parties need to be located for you to be able to help? Where should the mental health professional be based upon the parties?
So we need to be licensed in the state in which the person resides. So the people that I work with primarily are based in Florida and North Carolina. So if there's for instance, a intended parent that might be living in another state, an agency may reach out to me because whoever their mental health provider isn't licensed in Florida. So then I'll do the evaluation or the screening for the carrier, for the donor, or vice versa. They may have somebody, their carrier might be located in another state, but the intended parents are located here in Florida. So that
Right.
kind of situation, you really have to be licensed in the state. There are times that we will link up with another mental health professional
Okay.
that may be in the state where the intended parent or donor or gestational carrier is located. But best practice really is to be licensed in the state in which the
Absolutely.
person resides. Yeah.
And that's a constant question I face as the attorney, and every case is very
Yeah.
specific on who needs to be where based upon, there's no clear cut answer on every,
No,
match.
And I think, COVID kind of shook out because so much of it's telehealth. So, and there are therapists that are, it's called PsyPACs, that are licensed in multiple states. I don't have that specific degree, so we're still lobbying to have that same thing where I could apply and be licensed in, 20 different states. So that's in progress right now.
I mean, that's good. At least it's in the works to expand who you can reach to. So in a typical mental health evaluation, and we're talking about the screening that takes place prior to any embryo transfer when a intended parent or intended parents are matched with their surrogate, what is the best practice as far as who should participate in this evaluation?
So when I'm approached by the surrogate, when they reach out specifically, I always ask them, do they have a partner or a spouse? If we're talking on the end of the surrogate first.
Yeah.
If they have a partner or a spouse, I require that they attend the meeting. There's, the clinical piece of the meeting. That's the most critical part, really. And then there is a psychological test that the surrogate has to do. I'm sure there may be some clinicians that have the partner or spouse do it, but most people have the surrogate do that test. It's either the MMPI, which is the one I do. Yeah, the MMPI, which is a personality inventory, or people also will do the PAI. And so I require that the partner or spouse is part of that clinical meeting. And I always ask if they have had a group meeting with the intended parent, because again, best practice really is the surrogate and the partner, a group meeting with the intended parent or parents, and then an intended parent screening. So that's like all those bases. Every agency kind of does different things, but that's really best practice are all
right. Right. Because, the law in Florida at least doesn't govern that this even has to occur or how it happened. So we're many times guided by the best practices, to follow. And this is not something that people should cut corners in just because the law doesn't require it. It's an critical part of the process.
Right. So I'm a member of American Society of Reproductive Medicine, and I follow the ASRM guidelines. And we look at that as really the gold standard of practice. So, and, whether it's the surrogate or the intended parent or the donor, I know we're not focusing as much on that. I try to really reassure them that this is not a scary process. This may be the first time some people have ever met with a therapist. So I try to make them feel super comfortable that I'm not like, evaluating them on a couch and saying that there's something wrong with them and that they're crazy. And so if one message can get passed through by anybody who's listening today is that piece, that it doesn't mean that there's something wrong with them. It's really, I consider it more psychoeducational. It's not psychotherapy. It's not determining that there's possibly like psychopathology, because that's, I think, why they feel really nervous sometimes.
Absolutely. And I think that leads to another question is just generally what happens in the evaluation as far as what should the surrogate expect first, and then what should the parents expect to speak about with you?
Sure. So I do kind of a psychosocial approach. It's my social worker background in me. So if we focus, well, I kind of do it with both of them. I really do go through their background, their upbringing, their connection, their relationship with their parents. I talk about their education that they've had, a career that they're in, or what they do if they're not working for pay. They're working at home, because that should be a paid job, being a stay-at-home. Right. And so I kind of look at the psychosocial, emotional aspect of all of that, kind of a really good snapshot of their background, and then what led them to the path that they're on today. So looking at their support system, which is critically important for surrogates, really to have a good understanding of their support network. If they are not in a relationship, who's their tribe? Who are the people in their life that is going to be on the journey with them? I have a single mom surrogate that I evaluated yesterday, and she's got the most incredible extended family who go to appointments and do all of those things. So we really do look at the support system involved. We look at how they manage stress. What has caused stress in their life? How do you cope with stress? Because it could be a stressful process. How they feel about the medical piece of it, injections and treatment protocol. It's so critical to be able to have flexibility in their schedule if they have a job. how, because of monitoring and all of those things, do they have flexibility in their job to handle all of that? We look at prior loss history, if they've had prior loss in their life, um, and if they've had a history of, challenges with their own pregnancy, any history of any postpartum after the pregnancy. And then we all obviously we go through a pretty comprehensive mental health screening of a history of depression, anxiety, um, any kind of trauma history, hospitalization history, covering all of those things, to medications that they may be on. If they were on any kind of a like a psychotropic, antidepressant or something, when was it? What was happening? Has it been resolved? Have they been in therapy in the past?
Okay.
Because obviously people have been through things in life. That does not need to rule out, what's happening in the now, but we just kind of really go over all of those things, encompassing all
Does
of
the issue of abortion and reduction and her feelings on that come up in her individual session or the joint session, or both?
Yes, both, always both. So, and especially we're both, located in Florida, it's a critical issue that I talk about. So that is very much part of it. When and I let them know, especially if I have the privilege of doing the group meeting as well, I will let them know that I'm going to talk about some things now with you individually, but we're going to talk about this as a group as well, talking about the risk of multiple births, selective reduction, termination, because everybody needs to be on the same page. And even before the challenges of being in Florida, there may be somebody who is very much against abortion, and they really, for it to be a good match, you need to be on the same page with the intended parents that have a lot of their own feelings and concerns about it. So we try to get through all of that individually, and even if they have a feeling, which it's very normal to have that feeling, like they may say, if it were my pregnancy, I would not have a pregnancy. But I know that this is not, we want to make sure that the attachment issue, right? That they really understand this is not their child. They are doing this, and they're doing this because it is such a gift to give. It's like incredible, the gift that they're giving the intended parents. And they recognize that this so much is about what the intended parents want, and they will defer to them even though they may have their own feelings. But we want to make sure there isn't like some stuff kind of there making it challenging. Exactly.
How long does the evaluation typically take of just the surrogate? I know it's probably a range, but
yeah, it's a range. I always block at least an hour of just the clinical meeting, just not including the testing. The testing's additional. So
okay.
That can be like a 45-minute test that they're doing. So, and I have them do the test ahead of time, because I never base everything. First of all, I'm not a rubber stamp person at all. I don't just, they're good, like ask a couple of questions.
Right.
Yeah, sure, you should.
Then nobody any good service, like if it's not or if it's pup factory. Yeah.
Exactly. So the testing, although it does give a lot of information, sometimes it can raise a couple of things that I always like to bring up in the clinical interview, which is why I have people do it first. So in terms of like the time for the surrogate, they need to, and I tell them, block an hour to do the test, block at least an hour for me, because if they're trying to just quickly do it on a lunch break at work, I don't want it rushed because it may go over time. So I block a couple of hours for me. If we have the group meeting, that might be another 45 minutes with the intended parents. So that's why if we're doing, sometimes I'll try to do the intended parent meeting and the meeting with the surrogate same day for scheduling. And because the organic conversation flows nicely, it doesn't always happen that way. So that's why I tell the surrogate block a couple of hours just to make sure.
Okay. And can these sessions all be virtual?
I do them all virtual now. That is the beauty of it all. It's really, really nice. And it's made it great because there's a lot of people that are located all over the state of Florida, or now also North Carolina, right? So it used to be people would have to take the whole day off from work and drive into the office for a couple of hours. So it is all virtual, so much nicer, and it's just as effective. It hasn't taken away like the validity or the effectiveness at all.
Right. Absolutely. And then onto the other part of the question, what happens in a typical IP evaluation or intended parent evaluation?
So the intended parent evaluation, I go through, again, being a social worker at heart, I go through a very comprehensive psychosocial, their background, family, education, work, all of that, talk about stress, talk about their loss history, and which I forgot to mention when I work with a surrogate, I always ask them the most obvious question, like, what prompted you to want to do this? So we really do talk about, the intention behind it and the why, like what's the why? So with the intended parent, depending on what's brought them to the space, I ask the same question, what's been your journey? And I let them go through the journey that's led them. They've either been through a lot of fertility issues, they've had loss. I kind of go through, is this recent loss? Have they worked through what their experience has been? Because I do kind of approach things with that grief lens a bit and wanting to see what their support system is like. And a lot of them, if they've been in counseling, then that's amazing. That's helped them through this process to get to where they're at now. Nobody just decides one day to wake up and, oh yes, I think I want a surrogate, and we talk about.
It's usually the end of the road for a lot of parents.
Long road. So I really try to honor what that road looks like with them, that this is not easy. And if tears come up, I hold space for that because there's hope and there's excitement, but yet it's still been that journey as well. And with both, I talk about the relationship, what they want in the relationship with the surrogate, what the communication is going to look like. Again, their feelings about termination and selective rejection and quality of life. I go through all of that in the intended parent meeting as well. And with both, I talk about what does it look like after, how does it look during the appointments, that kind of communication, the connection after the baby's God, well, everything's good, the baby's born, what does it look like for them? And people are very clear. Sometimes it's intended parents, and for sure on the surrogate side, most of them really like an organic connection that develops. But there are the occasional intended parents that say, I don't know that I'll stay in touch with the surrogate. I would say that's so rare. Most of the time, it's like the check-ins. They like the check-in. They like the updates. It isn't a business proposition, and everybody's heart is really in it. Yeah, for sure.
As part of that evaluation, do you speak about how parents should speak to their children born through surrogacy? And, donor conceived is a whole nother, we have a whole podcast on that too, but.
Oh, yes. Yes. That is always what I talk about. I talk about it both on the surrogate side and on the intended parent side, because with surrogates, they will have had children. I talk about how they're telling their child that they're on a journey. A lot of times kids are like, oh, I want a baby brother and sister. And the surrogate is like, this is not ours. And we have that conversation of how they prepare their own children. Yes. So on the intended parent side, that's a huge part of what we do is talk about disclosure. Big piece of our evaluation is disclosure to who knows that they're going through the journey, how they're going to tell their future child that that they were conceived, using, what the love story looks like. I always frame it in like, this is a love story. This child so wanted, you went through so much to have this child. I give book recommendations. I give resources. Like for single moms who come in, there's a whole single mom organization. If people are, for same-sex couples, I always talk about what does their community look like? What are the resources? Because again, we're in South Florida. There's a lot more support and community in South Florida than some clients that might be living in the center or north part of the state. So we talk about what that looks like too, and talking about with their kids and how the conversations will look with their future children. Absolutely.
Yeah, that's a really important piece, because you can go through all this and then it's, then what? What do you do with all that information?
Right. I tell people the same thing like when they're getting married, right? It's not just about the wedding, it's about the marriage. So it's not just about the journey to have a child. It's then you have this child. What does that look like for the rest of everybody's lives? Yes, absolutely.
What's the recommended guideline on disclosure? Like, share if age appropriate? Like, what's the general rule of thumb on that?
Yeah. So again, I think that the conversation when it's donor conceived children, I kind of look at the blend of it all, because there are intended parents that are using donors along the same path. So I'm kind of speaking generally with donor conceived and with surrogacy here. It is always recommended open, honest disclosure. because in the surrogacy world, what if your child asks you, "Oh, I want to see a picture when you were pregnant"?
Right.
Well, there's no picture when you're pregnant. So right there, right, that's one thing kind of off the front. And and thank goodness, like in our world today, um, babies and children come into families in every single shape and size. That
Absolutely.
kids, the issues that children have usually are the issues because the parents brought into it as an issue. Kids are just like this, like open um, opportunity of learning and love and support. So when you frame it in a way from open and honest disclosure, again, even on the donor conceived side, that because as you've already, I'm sure, as you said, you've covered it, but in the world we're in today with 23andMe and Ancestry.com,
Yeah.
like you don't
It
want to
really
be
is.
afraid of.
Anonymous is not truly anonymous anymore.
It's a thing of the past. It really is. So, and there's so many amazing resources and good online communities. You know, you can go down the Google hole and find like not good information. So I try to give my clients good information of the donor side, the surrogacy side, and books to read and blogs and Instagrams and all of that that
Awesome.
help. Yeah, for sure.
Yeah, I find that even though the psychological evaluation is not legally required, just the benefit it brings that I feel like people don't even realize until maybe they've done it, how helpful and eye-opening it really is. 'Cause there's some of these things you might just not even think about until you bring it to their attention.
Yeah, it's so true. You know, I mean, at the parent side, well, everybody, you know, sometimes they're really anxious. Again, they've never met with a therapist and this, they feel kind of annoyed. It's why do I have to do
Right.
this?
More money, more time.
Exactly. But by the end, I would say 98% of people feel that this was so helpful. I never thought about it. And
Yeah.
sometimes they've never even discussed with their partner or themselves disclosure. Like this, it may be the first time they've
Mhm.
ever had the conversation. So you just want to make sure everybody is like thinking all this stuff through. And I realize too, and I honor it with them, that I'm asking them to think about things that are so in the future. And it's been such a journey to get to even now. So,
Right.
you know, I say I'm planting the seeds, no pun intended, that we're talking about this. But sometimes people come back years later. All right, we're ready to have the conversation with our kids. So we may be like a touch base
Right.
down the road. Yeah. And they can just kind of go through things again. And so
I was curious, do you ever, and you mentioned IPs come back, but do surrogates ever come back to you either during the pregnancy or after? Because and this is a huge mental health journey for them, too, is going through this.
Yeah, so there are some agencies that require monthly
Yeah,
appointments with a therapist.
I
I mean,
see
that's
that more and more.
cool. I
Yeah,
love that. I love that. I think the way we're approaching mental health in 2024 and beyond, I hope is going to just open up and break down the barriers, eliminate the stigma anyway, that it really is having that outside support person. So, and a lot of surrogates will ask, like, can I see you again? And I always say, you know, whether it's me or somebody else, bring it up to your agency. You know, they can talk to the IPs. Maybe it could be in the contract,
right.
whether it's me or your therapist, but I find it to be beneficial. So it's a small percentage. It's not all the time, but I see
Right.
that it's really a helpful thing to have that
Yeah,
and just
I do think that
support.
is a trend I'm seeing in agency compensation packages and allowance towards mental health. So I think
Awesome.
that's really, really, really helpful.
That's great.
And I'm curious, do you ever perform an evaluation? I know you said you're not picky, but you aren't going to turn a blind eye. I mean, are the evaluations ever resulting in just the match not happening because it's not recommended?
Oh, it happens. It definitely does happen. It's the hardest thing ever. Like, you know, I feel so fortunate. I had great relationships with my colleagues like you and all the different agencies and clinics that I work with. And one of the difficult times is when an agency or clinic like has somebody that they really love. They met them on the phone. You know, they've done their pre-screening, and now here I am. And there were some things that came up that whether it was really very obvious with their testing, and the testing is the most highly valid test that I go by that is best practice. So if something is so over the top, like even if I discuss it with them in a clinical interview, or other red flags that, you know, I mean, there from a donor side, there was a donor years ago that I worked with, I'm sorry, not a donor. She was a surrogate. Now that I'm thinking about it, she had lost her privileges of caring for her own child. I don't know what happened. And she felt this was her way of giving back, helping another parent have a child. It was very obvious she was not mentally in a mental stable place. So that was not a go at all. So it does come up once in a while. And, I have to worry, obviously, not just about my license, but it's a future child that we're talking about here in a relationship with the IPs. This isn't just about the moment. It's such a bigger, complex issue for sure.
Yeah. I always feel that as hard as it is for a match to break, when it's something like a red flag, I do feel like it's a bit of a blessing in disguise, because to have the problems spotted early just is such a huge benefit to everyone at the end of the day. And I know the personal, like, former intended parent, it's painful to get the brakes, pumped on your process, but it really does. It's better to know sooner rather than later.
Absolutely. I try to tell them that we get so caught up in, like, so much time feels like it's passing, right? Another month, like people in the fertility journey, oh my gosh, this is going to set us back. But over the scope of time, if we could widen the lens over a lifetime, what was a few more months or another 6 months of finding the right match, the best situation? It doesn't matter.
When an evaluation doesn't look good to you, who makes that ultimate decision? Is it for the intended parents to decide if they're comfortable with that, or will the clinic just not allow it? Like, what actually cancels the match?
Right. So one of probably the statement that I write at the end of my screening is, this client appears appropriate for treatment, right? So if I have concerns, I put that in my report. Due to XYZ, it is not my clinical opinion that this person should move forward. So once a clinic gets that, I don't think anybody's going to take a chance and move forward. Again, not that I'm the red or green light. Maybe there are. Maybe, and unfortunately, there's some sketchy there's some sketchy GCs out there that will hop and, just pretend like I never had this screening. I'm going to go to another agency and start from scratch and never disclose. It's like we have to really be aware of what's going on out there and have the best practice possible.
Not to skip any steps, just follow the best practices. Absolutely very important. And one of those things being that I have clients who said, my surrogate was a surrogate for someone else. She did an evaluation a year ago. Can't we just use that? What's your position on that?
Oh my God, that happens all the time. No, in 1 year. That's, again, the ASRM guideline is 1 year. Things change. I did an intended parent screening that I met with them a year and a half ago. They had a match with a different GC. I don't know who the GC was. Whatever happened, it didn't work out. So now we're down the road so much longer. They needed to do an update. And I try to be I had already done the first one, so I was very thoughtful about it. I adjusted my fee. I said, as a courtesy, plus I have such compassion what they're going through. So I looked at all of that, but I did an update for them. And you have to. Things change, things happen, circumstances. So it's important to go over
that. Someone going through this repeatedly, like, updates are an option. You're not necessarily starting from scratch. So that's good for me to keep in mind too, for clients who just really resist. And I'm always so grateful when the clinic is the gatekeeper of really not allowing them to proceed, because not all clinics necessarily require an updated evaluation.
Some clinics don't even require any,
right?
Which is scary to me. Like, what? It's like you're just riding a horse out there in the middle of, I don't know, Wild West. So no.
Yes. So we stick to our guns and what we know is right and recommend what we think is best. That's all we can do at the end of the day. So when should the parties come to you? When does this all happen?
It's so funny to me when people reach out, and it's usually, the carriers reach out right away pretty quickly because they're just so excited. They're like, I got to do all the things. I can't wait. So I get, it's like they reach out to their agency, and then I hear from them pretty quickly. The IPs, it's the opposite. Either people call right away, the real planners, right? They're like, I got my list I'm going through. Or they wait till the last minute. And maybe they wait till the last minute.
Done by Friday.
And those calls happen. And especially when it's an agency or a clinic or colleague I work with, frequently I try my hardest to get them in as fast as possible. It doesn't always happen that way. So what's best is just when you get the to-do list, you've got time, don't stress. It's too stressful if you wait till the end, plus availability, and I have to write a report and all of those things. And they're running around trying to do all the things. So as soon as you know you're on the path, it's best to just, reach out.
And in most cases, the parties do not start the legal agreement with me until they've performed the psychological review and the medical evaluation. So those two things typically occur before getting into any legal agreement. But it helps because what you all talk about impacts what comes to me at the legal stage. So it's a nice flow.
Yeah, that makes sense. Right. So if it's like the starting point, then everything else is going to flow much more easily.
And what is the best way for surrogates or IPs or anyone that needs mental health counseling and what you specialize in to reach you?
Sure. So a few different ways. I have a website. It's just my name, Karyn Rosenberg, and it's Karyn with a Y. I always say it's not that kind of Karyn. But Karyn Rosenberg, B-E-R-G. Yep. Send me an email, Karyn@KarynRosenberg.com. Phone call, 561-306-0232. Instagram. I'm on Instagram. It's my handle's Karyn with a Y, LCSW.
Awesome.
If you want to see some fun content of me trying to learn the bass guitar, I have a TikTok at the same handle too.
I didn't realize you play bass or learn bass.
Trying to.
Well,
But
you got to start somewhere. That's really, well, I will definitely be checking that out. That's very cool. Yeah, well, thank you so much for joining. And anyone listening, please feel free to reach out to Karyn for any of your mental health needs. She's amazing. It's so kind. And I know you love what you do. It's always so great working with you. I know when any of my clients are with you, they're an absolute great hand. So thank you for everything. And thank you for joining the show.
Thank you so much for having me. I always appreciate getting to work with amazing colleagues like you. So thank you for sending folks to me, and good luck with the podcast. Thanks for having me here.